So today we are excited to have three presenters who will talk about their work in outbreak investigation and preventive policies for Legionnaires disease. So firstly, we have Mark McCabe, who is an epidemiologist with the Population Health Observatory at Fraser Health. His program support areas include communicable diseases, environmental health, and climate change. Mark is a recent alumni of the Canadian Field Epidemiology Program, during which he provided epidemiological support to several outbreaks and public health issues in the Fraser region and other parts of Canada. Chris is a registered professional engineer, a registered professional biologist, and a certified small water system operator. He served on the steering committee. Sorry, can you put your phones on mute? Thank you. If your phone's not on mute, please put your phone on mute. Thank you. All right. And Chris served on the steering committee for the 2019 NSF and NIHA Legionella conference in Los Angeles. And Philip White is involved with various boards, safety standards committees, and code committees, including the ASHRAE 514 Project Committee on Minimizing Risk of Disease and Injury associated with building water systems. He has over 25 years experience with complex mechanical systems, mechanical design, rainwater reuse, and appropriate codes, regulations, and acts. So during the presentation, you may enter your questions into the chat box for the presenters, and we'll get to them at the end. Thanks, Mark, Chris, and Philip. Mark, please go ahead. Thank you.
Thanks so much, Tina. Hi, everyone. So first, thanks to the NCCEH for this opportunity to share about Fraser's investigation of the Legionnaires disease outbreak in 2018. My objective of this talk is really just to share the story of our investigation and our lessons learned, and in the end also to share a novel tool that we used from Environment Canada that I think will pique your interest. So let's jump right in. Before we go through a play-by-play of the outbreak, I just want to cover a bit of background. So what is Legionellosis? It's a disease caused by the Legionella bacteria, and 90% of human infections is caused by a specific species, Legionella pneumophila. Further to that, serogroup 1 is the most common variant of this, involved in human disease, and we can further differentiate Legionella pneumophila SP1 by sequence typing, and this is really important for linking cases to potential sources in an outbreak situation. There are three forms of disease. There's asymptomatic infection, there's Pontiac fever, which presents as a mild illness, and we don't usually typically see these in outbreak situations because they are mild. What we're really interested in is Legionnaires disease, which presents as an atypical pneumonia. It's treatable with antibiotics, but even so, unfortunately, we do see a mortality rate of 11 to 25% of those infected with or inflicted with Legionnaires disease. Looking at the risk factors, what puts a person at risk of contracting Legionnaires disease, we see older adults greater than the age of 50, and we see that males, smokers, and those with underlying conditions, particularly things like COPD and diabetes, are more at risk of developing Legionnaires disease when exposed. So where do you find Legionella? Legionella is ubiquitous in fresh water, and it can also be found in soil of specific species, but for purposes of this talk, we're discussing Legionella in water. And it's transmitted when we inhale aerosolized particles, so potential sources could be individual sources such as nebulizers or CPAP machines, and it can range from that to things such as cooling towers or water fountains. And it's really a health risk when conditions promote the proliferation and aerosolization of the organism, such as is found often in cooling tower environments. And how common is Legionellosis in the Fraser region? So I'm showing here the last decade and a half of the Legionellosis rates in Fraser as well as in BC. And we can see that there's been an overall increase in the last decade and a half. And this is consistent with what's being seen internationally as well. And just to set a baseline, typically since 2012, we've kind of expected about 5 to 6 sporadic infections on average per year. So this is why, moving now into the start of the outbreak, it was in late August when we were notified that we had 6 cases reported in 3 days. So looking at this number, you can see that this is quite alarming already, that something does seem to be going on. And what I've plotted here is the onset dates of the cases on this timeline. So when we looked into these 6 cases, we saw that 2 of them were most likely travel acquired, so we weren't too concerned in terms of the public impact of this. But 4 of the cases were actually residents of Surrey, and further 3 of them were from a specific neighborhood called Guildford. And when we mapped these, we also found that they were very co-located, residing within 500 meters of each other, as well as close to a shopping center nearby. So we instantly knew something seemed fishy, and we took the measures to get everything in line for declaring this an outbreak, as well as having our environmental health officers out on the field doing an environmental assessment of 2 city blocks around this cluster of cases. They were searching for any kind of sources of aerosolized, potential aerosolized sources, and public works, that sort of thing. They didn't see anything of note. They went to the shopping center, and we did find several aerosolized water sources, such as fountains and green walls, things of that like. But unfortunately, at the time in BC, there was no cooling tower registry, so they had to follow up with center managers and operators to determine whether the shopping center had cooling towers. In the end, we found out that we identified 10 cooling towers at the shopping center, and because of the epidemiology and the co-location of the cases in such close proximity, we decided to sample all 10, in addition to the other sources of aerosols at the shopping center. And sorry, I'm just going to take a step back for a second. If your phone is not on mute, could you please make sure to mute that? That'd be great. Thank you. Okay. So while we were waiting for test results, very shortly after, we received notification of more cases, which really just further supported our source area, because we had 3 additional cases the following week reported to us, and 2 of them resided in or near the Guildford area, as well as having visited that shopping center as well. And with a quick turnaround that we expect from nucleic acid testing and PCR, we did receive results fairly rapidly for the environmental sources. And there were, of the environmental sources, all of them were negative except for the cooling towers. The cooling towers were the only ones that came back as positive. And out of those 10 towers we tested, 5 of them were positive for Legionella species. 1 was positive for Legionella pneumophila. 2 were positive for Legionella pneumophila SG1. As you recall, that's the serogroup most associated with human disease. So I'm quite.
Thanks.
Oops. Sorry, somebody's not on mute. So this was quite alarming to us, as out of 10 towers, 80% of them were contaminated with some form of Legionella, 2 with the form that we would be most concerned about in terms of causing human illness. And so regardless of whether it was a suspected source or not, we had to have these towers shut down and remediated, and as part of our precautionary process, because they are potentially a risk. And then we were very interested in the 2 SG1 towers in particular. It would be not very wise right now at this point to feel good about the fact that we may have found a potential source, because of the epidemiology. Living in close proximity to the shopping center, you would expect residents to report visiting the shopping center, and we would want to take precautionary measures to make sure we find any other potential sources. So this is the approach we took. We kept our eye on these towers, made sure they were cleaned, and we sent the specimens for further subtyping, sequence typing, but we wanted to make sure to cover our bases. So that's what we did. One of the ways we did this was we wanted to collect enhanced data from our cases. So the initial interviews that are undertaken are quite broad, and they cover potential individual sources and more potential public sources. But we wanted to collect additional information and more detailed information about their habits during their exposure periods, where they visited. In addition to applying the context of the Guildford neighborhood here, this would also allow us to classify new cases that appeared as part of this outbreak or not. So this right now, I'm showing the analysis of the enhanced questionnaires, and this is at the end of the outbreak for all 14 cases. But what we saw early on when we started analyzing this data was that most of the visits were still within the vicinity of that shopping center cluster of cases. We did also see that there were a few other commonly visited locations. There was a nearby public facility and a large supermarket approximately 500 meters west of the cluster. And I should mention, so the case residences are represented by the red houses. The dots are the visit locations. The size of the dots represent how many of our cases reported visiting, and the number inside also specifies that number of cases. And the concentric circles are 1 kilometer radii away from the center of the cases. All right, so we had 2 other additional suspicious locations that we wanted to check out. And the other thing that we did was we had our health protection team in partnership with the City of Surrey work to try to identify buildings within a 2-kilometer radius of the cluster that could potentially have a cooling tower. And we had to do this, of course, because we didn't have a cooling tower registry or inventory available to us. But they used satellite imaging and infrastructure maps to try to identify which buildings may potentially have cooling towers. And in addition, using this information in addition to the exposure analysis I just showed, we felt like we had enough evidence to investigate and sample the public facility and supermarket. But the supermarket didn't have a cooling tower, although we did find that the public facility had a cooling tower, and we sampled that one immediately. So in addition to these targeted measures that I've just described, we also wanted to take a step back and think of other ways that we could try to capture any potential sources that we didn't have eyes on that we might be missing. What kind of measures could we take to mitigate any impacts? So other jurisdictions had an approach where when they see a cluster of cases, they not only do an investigation, but they also do a precautionary measure where they notify all building operators of cooling towers in the vicinity just to do preventative maintenance. And so we decided to take this approach as well, especially since we'd already identified buildings within a 2-kilometer radius. So we extended that to 4 kilometers based on the literature of the average distance that the organism is known to travel from a source. And we identified buildings, sent letters to each of them to do 2 things: to confirm the presence or absence and operational status of their cooling towers if they have one, and recommend preventative maintenance. But this was a very laborious piece of work, and I'm going to go into that a little bit later as well, but it was also very useful. So then, while this was all going on, we received a lab update. So the PCR came back for the cooling tower at the public facility, and it was positive for Legionella pneumophila SG1. So now we had another very highly suspicious source suspected. And then in terms of the isolates that we have obtained for sequence typing, we were unfortunately only able to obtain 2 environmental isolates. Only one of the 2 SG1 contaminated cooling towers at the shopping center yielded an isolate for us to send for sequence typing. But luckily, we also got the public facility cooling tower, an isolate from that sample. And then of our cases, of which we had around 10 at this time, we were only able to obtain 2 clinical isolates. But luckily, when those came back eventually a few weeks later, those clinical isolates were identified as the same sequence type, ST109. So we could feel somewhat confident that this was at least one of the sequence types associated with this outbreak, since 2 clinical isolates had the exact same fingerprint, the same sequence type. Another thing that we did early on in the outbreak was to look at previous cases. We went back several months to see other Legionellosis cases that were reported to us that at the time weren't felt to be linked to each other, but now that we had a cluster and further information, we wanted to see if they could be associated with this outbreak to provide further data. So in June and July, we had 5 additional cases. And back then, when we had looked into it, we hadn't seen any linkages other than some geographical linkages, but nothing epidemiological or microbiological. As you can see here, we got sequence types back for the 5, and they were all different with the exception of one unknown that we couldn't get sequence type 4. But as I just showed on the previous slide, our outbreak was now identified to involve ST109. So we were quite amazed to see that one of our early cases, previous cases from mid-June, was ST109 as well. So we had to include them as part of this outbreak. And we also included this Surrey, North Surrey resident as a probable case based on the enhanced questionnaire that we applied to the current and previous cases as well. So now we felt like we had done our due diligence in targeted interventions as well as the global. We really were now hoping to find a link between the environmental source and our cases. So it was, when we finally got our sequence typing results, this is what we saw. So again, we had 3 now of 14 outbreak cases confirmed to be ST109. The remaining were unknown. And then for our cooling tower isolates, the SG1 contaminated cooling tower at the shopping center came back as ST1777. So not one of our, not matching to any of our cases. But the public facility cooling tower came back with the ST109. So we now had confirmation that at least this public facility cooling tower was one of the sources of this outbreak, and we could feel good that we identified it, had it remediated immediately, and hopefully mitigated further cases from appearing in the weeks following that we were investigating this outbreak. So this is what the outbreak looked like in the end. Here's the EPI summary of our cases. So we had 14 outbreak cases altogether. Of the 14, they were all ended up being hospitalized. 7 required intensive care, and unfortunately 2 passed away from the illness, providing a 14% case fatality for this outbreak. Here's the EPI curve, and as you can see that the majority of cases occurred in August and September, with the peak in mid to late August, and then as you can see there, the time difference between those early June cases and the rest of the cluster is quite interesting. And then here I'm just showing the key moments in our outbreak investigation when we identified the cluster and declared the outbreak, from when we closed the shopping center cooling towers, the public facility ones, and then given 1 incubation period without cases that could be attributable to any of our suspected sources, as well as a sufficient reporting delay, we felt comfortable declaring the outbreak over at the beginning of November there. Now, looking at the geographic case distribution of our outbreak, again, the red houses are the residences of our cases. We can see that, and focusing on the concentric black circles, which are 1 kilometer radii from the cluster of cases, we saw that 12 of our 14 cases resided within 3 kilometers of the source. Half of our cases resided within 1 kilometer of the source. All but 1 were residents of Surrey, and nearly half of them reported visiting the source facility directly. Majority of cases visited the shopping center, and as the shopping center was in such close proximity, it's not within beyond reason that could be an exposure source, exposure means as well. So now I just want to quickly cover some of the key challenges and considerations, kind of emphasizing what I've touched on in the play-by-play. So here's the cooling tower inventory that resulted from that precautionary 4-kilometer distribution of letters. So our EHOs went out, distributed these letters, and then confirmed with buildings to see if they had cooling towers. And what you're seeing here with the yellow dots are the buildings that did end up housing cooling towers. So if we look at this based on the distribution of cases, you can see that if we had had this information early on in the outbreak, there's only a handful of cooling towers co-located with that cluster of cases, the initial cluster, just 5 additional potential sources. And so it wouldn't have been beyond reason to have them sampled and tested as a precautionary measure early in the investigation. It's not too many more towers, and just to be sure that we're capturing the entire picture. And the other thing is with the global measures, we can see that there aren't. Had we had this at the beginning as well, we would know exactly which buildings to distribute letters to and allow for more resources for follow-up, because it's much more manageable compared to what I'm about to show you. So the blue dots here represent all the buildings that were followed up by the EHOs. This is almost 160 different buildings in order to find under 20 buildings with cooling towers. So as you can see, this is a huge piece of work, and I think it's a huge example of the reasons why cooling tower registries are so valuable in these situations, depending on the circumstances. And so just to reiterate, the benefits of a cooling tower registry, we can use them to inform our targeted interventions, the global interventions, as I mentioned. And then, of course, the best intervention, which is the prevention. It provides a monitoring, reporting pathways, and standardization of maintenance, testing, and remediation. The other piece that I want to talk about is the source attribution for this outbreak, or the question of whether the source that we identified was the source or just one of multiple possible sources for this outbreak. So, of course, we found that the public facility cooling tower is a confirmed source. It matched to 3 of our clinical isolates, but we still had 11 cases that we could not get sequence typing for, right? So that's really where the question arises. We had one shopping center cooling tower that could not be typed, and the other shopping center cooling tower identified as ST1777. So had we had a few more clinical isolates for our remaining 11 cases, and if one of them had been identified as ST1777, then we would have had to conclude that this was a multi-source outbreak. Not knowing this, and because of the limitation of some of the laboratory testing trying to obtain these clinical isolates, I think this really emphasizes the importance of those global measures, those global precautionary measures that we take to try to mitigate the impact of missing potential sources that we're missing or are not able to detect. And now I'm excited to go into discussing this novel tool that we employed from the Environment Canada team. So in any Legionella outbreak, something that comes to mind is the fact that the organism is dispersed in the air, and they can travel for very large distances, up to 10 kilometers as reported in some of the literature. So one of the things that is often explored is the idea of dispersion modeling or plume modeling, which I provide an example there on the top right of plume modeling in an outbreak in Europe. And but one of the things that plume modeling involves, it's very data heavy and can take some time, and interpretation of the results can also be challenging at times. But nonetheless, this is definitely something that's interesting to explore and can help to inform an outbreak investigation. So we contacted Environment Canada with the hopes that they might support us in some plume modeling or some dispersion modeling. And they were very happy to support, but they also presented to us a novel tool that they had been working on that could serve as sort of a precursor to this, something that it takes less time to generate, and that could help us, that could be more easily interpretable and kind of give us an idea of dispersion in a much shorter time period. And these were called range roses. So you're seeing an example of a range rose there on the bottom right-hand side. And what these range roses do is that they display the maximum distance and the proportion of time that an organism, in this case Legionella, may have been dispersed from a source location. And the maximum distance of travel, we estimate that using meteorological wind data as well as other meteorological conditions that can impact the survival of an organism in an aerosol, such as temperature, relative humidity, solar exposure. In our case, we used the literature to determine the average lifetime of Legionella would be about 15 minutes, so we applied that to the range rose. So the range rose here represents an average lifetime of 15 minutes for airborne Legionella. And for those who are familiar with wind roses, really what a range rose is an inverted wind rose with the distance, with the travel distance applied, overlaid on top of it. So just to go into a bit more detail, this is the range rose for our outbreak period, our entire June to September period. And the concentric gray circles around the range rose represent the proportions. And the center of the range rose, that white circle, is, we can imagine that to be the source, and the arms extending is the direction that the organism was dispersed from that source. But one thing to note is you don't want to focus on the area of the arms, but more the length of them, because that represents how far they traveled, and the colors represents the distance. So for example, let's focus on the hatched black arrow that I've drawn there, going to the edge of the yellow arm pointing east. So if we look at the concentric circle, that corresponds to 8%. And looking at the color key, you can see that represents 1.5 to 2 kilometers. So the interpretation for that part of the range rose would be that for 8% of the time, Legionella pneumophila traveled a maximum of 1.5 to 2 kilometers east from the source during this time period. And what can we use range roses for? So when we don't know the source, when the source is unknown, we can use it to assess likelihood of potential sources by observing what the range roses look like and seeing how the cases appear with reference to the different range roses we might generate for a given area. We can also use it to identify areas for targeted source investigation. And then when the source is suspected or known, as was in our case by the time we received these range roses, we could use it to corroborate the observed case distribution around an implicated source. We could use it to try to hypothesize the most plausible means that a case was being exposed to the organism, and then we can also use it to identify populations at potentially greater risk to help inform interventions if need be. So just to demonstrate, this is the outbreak range rose again, and you can see even just by glancing at it that what we saw during our outbreak was very minimal dispersion in a southerly direction, and that the maximum travel distance we could calculate was approximately 1.5 to 1.7 kilometers on average. Looking at the range rose against our case distribution and focusing on the point B there, which is the confirmed source, you can see that it's relatively consistent with only 2 cases south, but the majority being in the directions that would be suggested by the range rose for the outbreak period. One other thing we can do, and we found this very interesting, was the hypothesizing about the means of exposure for a given case. So what we did here, if you look at the range rose on the right, is we requested a range rose for the specific exposure period of a given case. And so this was for the case, our first case with onset on June 19th that had ST109 confirmed. So this was definitely an outbreak confirmed case. And the case had reported visiting the source and shopping center, as well as one other location that I've labeled there with the 3.0 kilometers from the source. So looking at this information, we can see that if you look at the map, the case resided almost 3 kilometers south of the source labeled by B. He only also visited a location 3 kilometers south, other than actually having traveled to the source and to the shopping center. If we look at that against our range rose here, we can see very little travel dispersion in the southerly direction. And when there was southerly travel during his exposure period, it wouldn't have been more than 2 kilometers. So in this case, we can hypothesize that this person was most likely to have been exposed to the organism through traveling in very close proximity to the source, rather than having the organism have traveled and exposed him at his place of residence or his area of residence. So that was quite fascinating to us to use the range roses for this purpose as well, to understand the distribution and dynamics of this outbreak and the distribution from the source. So in summary, I hope that I've captured the strategies, considerations, and tools that we used for investigating this Legionnaires disease outbreak. And in particular, I'd like to emphasize that, how useful the global and targeted intervention strategies were to overcome given the challenges that we faced. I hope I piqued your interest in the range roses, and I hope I've emphasized the importance of cooling tower locations during an outbreak investigation, how this information can really expedite the process and help to inform the strategies as well as prevention. And so I just want to take a moment also to thank everyone involved in this work. You can see here under Fraser Health, we had a representation from several different areas that formed the outbreak investigation team. We had support from the BC Centre for Disease Control for the testing, as well as some EPI support, and then the Public Health Agency, National Microbiome Lab for the sequence typing, as well as those range roses from the Environment and Climate Change Canada team. So thank you so much, and with that, I'd love to pass the mic on to Chris and Phil to talk about their awesome work that they're doing in the city of Vancouver.
Thanks, Mark. I'm going to pass it over to City of Vancouver.
Great. Thanks, everybody, and thank you, Mark, for teeing it up so nicely for us. Our key message is make friends with your building department. This is what's happened in Vancouver. My name's Chris. I'm the one speaking here. Phil is also going to be speaking. We're both on the buildings department side, and we've had a really incredibly strong collaboration with our local health authorities, to the point even where 3 weeks ago now, Vancouver Coastal Health has seconded to us an environmental health officer full-time for a year. So Arnie Faramo is also with us in the room. So next slide shows how we hear about Legionella, which is an outbreak. So this is the one that was in 2005 in Toronto. It was a cooling tower source. More fatalities than the Quebec City outbreaks that had happened in subsequent years. This is typically how we hear about Legionella, but the next slide shows that we also have what are this terrible term that unfortunately epidemiologists use of sporadic cases. I mean, sporadic is really a bucket for meaning we don't know where it came from, right? And so in this interesting paper that came out earlier this year from Humber River Hospital in Toronto, they just surveyed between May and October 2018 patients in the ER who had pneumonia. Lo and behold, 28% were positive for Legionella, so probably some of those wouldn't have even been diagnosed with Legionella to begin with. And then if you apply the classical definitions of outbreaks, the summary is that there were at least 3 outbreaks that occurred in North York, Ontario in the summer of 2018. So again, underscoring that surveillance is medical surveillance is a key part of this, and that sporadic cases really need to be thought of not as something random, but they probably are attributable to something. And that's probably why, like on the next slide, partly why we're seeing the increases that you've seen graphs like this before. The top is the official numbers from the CDC in Atlanta. If you've seen the National Academies of Science report that came out in August last year, their number estimate is about 10 times that. So they're saying 52,000 to 70,000 cases of Legionella per year in the United States, which is an extraordinary number considering that Legionella fatality rates are on the order of 1 in 10. So we really have no idea of the vast majority of Legionella cases that are happening out there. So what happens is on the next slide, and sorry, I know there's people from Aurelia on the call, not to throw you under the bus, but when these outbreaks happened, or like what Mark described in Surrey, everybody suddenly is interested, well, where are the cooling towers? So up comes Google Earth and Google Street View and whatever else you've got to try and find cooling towers. We're going to go through some pictures to show you why that's not going to find you all of your cooling towers. And so why not get ahead of things? Why wait for the outbreak? Develop a registry. That's the other second key message. So unless you're in Hamilton, Ontario, or in the province of Quebec in Canada, you probably have no idea where your cooling towers are. The next slide shows Moncton. Again, not to throw Moncton under the bus, but they similarly had an outbreak last year, to the point where then the mayor was asking the province in New Brunswick for a province-wide registry to start. So again, hopefully we're not waiting for outbreaks to happen in all our jurisdictions to get to this point. We know we've all been through, there's been many jurisdictions that have gone through this. Why not be proactive, right? So the next slide is a little content heavy, but it's some references for you for why we're focusing on cooling towers. We're going to be talking about decorative features as well. When you look at outbreaks, 60% of the outbreak-associated deaths have been associated with cooling towers in the one study by Hamilton et al. When you're looking at those so-called sporadic cases, and when they looked in Glasgow over about a decade period, they found that your proximity to a cooling tower increased your relative risk of acquiring Legionella. This is possible in the UK to do these studies because they've had a national registry in place since 1992. So that's why you're seeing in the next reference why they're giving numbers like 20% of the so-called sporadic cases are from probably attributable to cooling towers. The next one's a little bit frightening, where Legionella could be dispersed from cooling towers up to 12 kilometers. Mark referred a little bit to that, and now you imagine a complex downtown core and how difficult it would be to pinpoint a source. And then the last bullet point was just talking about how cooling towers can even potentially recontaminate other cooling towers as well. So it makes these things much more complex. I'm going to pass it to Phil now to run us through a little bit of show and tell.
Okay, thanks, Chris, and hello to everybody. So if we can, so on this slide here, this is showing you what we're up against in the city of Vancouver. These are brand new buildings, probably, I think they're 6 stories in height, and each one has a cooling tower, and they're residential strata buildings. So we have a problem with stratas managing to clean their sidewalks when it snows here. So getting them to look after a cooling tower is very, very problematic for us. So on the next slide, you can see cooling towers. So this is a arena downtown Vancouver, and we're not saying there's anything wrong with this cooling tower. It's not maintained properly, but it's the proximity to that residential high-rise, like the correct wind direction, and there's going to be there's more development going on behind this building. So as the city densifies, the summers get hotter, there's going to be more and more cooling towers, and being very, very close to multi-unit residential buildings. On the next slide, it shows you that these towers aren't always located on the rooftops, or they will be hard to see from like a satellite image. Sometimes they're on street level. If we go to the next slide, there you can see this one is located at ground level. It's for a hotel, and this is something that you probably wouldn't see looking at satellite imagery. On to the next slide. We have, so these cooling towers, they exhaust at the side of a building, they're directly below an observation deck. And you can see the staining and the growth on the wall there just above the grills. So when you're looking at a satellite image, you're probably not going to pick out every single cooling tower as well. And then on to the next slide is another example of a cooling tower exhaust. This one's exhausting directly onto a public pathway. There's an entrance to a building close by, and a lot of the times we're finding these in where a grocery store's moved into a building, and it's for their cooling needs. So the next slide shows you a installation. Basically, this is a poor installation. So you've got the cooling tower close by to the building air intake. Obviously, when this put in, the ASHRAE standard 62.1 hadn't been implemented, but now that standard has 7.5 meters from the cooling tower exhaust and 5 meters from the sump to any building air intakes. And then on to the next slide. This is where we really want to get to in the city of Vancouver. This is taken from New York State. It's their registered cooling tower map. It's public facing, so you can just go on and hover your mouse over one of those dots, and it would tell you what the equipment is, when the last Legionella sample result was taken, if it was over 1,000 CFUs. It gives you a lot of data, and that's where we're going with the city of Vancouver. So on to the next slide here. This is why we're doing it. So operating permits already exist in the province of British Columbia. They exist for hot tubs and swimming pools, which are governed by the local health authorities. And also provincially, we have operating permits for elevating devices, for pressure vessels, that kind of stuff. But currently, there's nothing in place for, or there was nothing in place for cooling towers or decorative features. So we've brought out requirements for cooling towers, decorative water features, rainwater harvesting, and building water treatment systems to be registered with us through an operating permit program. And one reason why is because cooling towers, they're an engineered design, and if they're not maintained, obviously they can lead to a public health outbreak. So going on to the next slide, shows us that as of January the 1st of this year, in the city of Vancouver, all new and existing cooling towers and evaporative condensers do require an operating permit. That operating permit is very simple to get. It's just, you just go into the city's webpage, you open the account, you tell us where the cooling tower is, you can put down the disinfection type, you can put down as many contacts as you want, and then we have that information, and we'd be putting the location on a public-facing GIS map as similar to New York State. So obviously, we don't want to just concentrate just on cooling towers, like we've mentioned decorative water features. So if you go on to the next slide, we can see here that this was a JW Marriott in Chicago. And this was a water feature that there's 114 cases, which resulted in 3 fatalities. And then on the next slide to that, shows you that the Department of Veteran Affairs in the United States basically recommended non-use of all their water features. So basically they said no more water features in our buildings. So they sent out that alert or bulletin. The top right picture shows that was in South Dakota. So you can see there's no obvious aerosol generating capacity from it, but that actually resulted in 18 cases. And then in the lower right-hand corner, that was like a decorative fountain that actually underwent routine cleaning and maintenance, ionization-based disinfection system, free chlorine tests, but it has the floodlights, and on the back side of that wall was a fireplace. So the lighting with a fireplace probably contributed to warming up that water in the system, and there was 8 cases from that small feature. So on to the next slide, the regulations for decorative water features. That starts July the 1st of this year. We've actually had people register already. You can pre-register, and that includes indoor or outdoor features. A lot of the features in the city, the water feature will start indoors, it moves outside, and then comes back in again. So it's all water features. So on to the next slide, we'll show you what that's going to look like. So this is just a quick screenshot of operating permits that have been issued since December the 1st. The red dots show the cooling towers, and the light blue ones are the decorative water features. Now, we estimate there's probably over 700 cooling towers within the city. So we have 3 inspectors trying to educate, getting the word out there. And Chris and I have been doing lots of presentations, trying to get the education piece, and also that we want everybody to register just in case of a public health outbreak. One part of this that makes it work is that we put this regulation into the building bylaw. A lot of these regulations sit in a health authority's bylaw, but the reason it's working here is because every building that gets built, aside from single-family dwelling, goes through a plan review. We review the mechanical system, we do the inspections on the mechanical system, we see the commissioning of that mechanical system. So it just made sense to have our inspectors who come with a mechanical background to run this operating program. Back to you, Chris.
So on the next slide, we've had tremendous local support. We've been really pleased with the response. So on the left is a screenshot from the LinkedIn profile of the local president of the Building Owners and Managers Association of British Columbia. Totally supportive of what we're doing here, sending out a reminder to his members. Tourism Vancouver has been absolutely fantastic as well, hosting their own workshops even, and bringing in speakers to talk about this and putting the word out. So the local industry and business owners and managers get it. We've spoken to portfolio managers as well too now, who have said that they're basically just going to roll out what we're even proposing across their national portfolio, so even beyond the jurisdiction of the city of Vancouver. On the next slide, we've also been really pleased that we're very thankful for help from the CDC in Atlanta, which is also recognizing the work that's happening here. The only opposition we've received is going to be on the next slide. And this is from a group that if you propose anything to do with Legionnaires Disease, you may hear from this Alliance to Prevent Legionnaires Disease, a very interesting name to this group. I'm going to just give you a few seconds to read the transcript here from New York City. It's self-explanatory. Any questions, you can give me a call. Okay, so if you need any more info, give me a call. So these are all the things that we have that have been approved by council and are being implemented. The next slide is going to show you what we are proposing to council in May for implementation on January 1st. So I'm going to summarize the points for you, and then in the Q&A or future conversations with you, we're happy to elaborate. So number 1 is we're going to require a 1-year maintenance contract for new cooling towers. Going to that residential strata example that Phil shared, right now, the strata owner, the strata corporation is not even formed yet. The building gets turned over, they get the keys. Do they even know they have a cooling tower? So before that occupancy permit is even issued, we would be asking council to require that they at least have a 1-year maintenance contract in place to start off with. The second, pretty basic, require on-site maintenance logs. Third, this is quite new, would be to implement a building water system operator certification through our provincial environmental operator certification program. I think all of your provinces will have a similar body. So this criteria is being developed through the Association of the ABC, whatever that stands for, I've forgotten. So it'll be freely available to you. This will be launching in fall. The idea is to get just some basic competency out there in terms of water quality, sampling, treatment, the basics of what to look for in terms of backflow prevention. So it raises the bar a little bit about out there, what's happening out there, because it is the Wild West. Second, or the last point is it was requiring Legionella pneumophila testing and reporting. So that would be monthly for cooling towers and every 2 months for decorative features and non-potable systems with some prescribed corrective actions. And I really want to highlight the excellent reference that's the federal government's MD 15161 standard. We have very deliberately harmonized with the federal standard so that we're not starting to create a patchwork of regulations across the country. They have excellent success with their work, and so why not emulate them? And to underscore the importance of Legionella pneumophila testing, the next slide shows Patrick Racine looked at data from Quebec, where they also require monthly cooling tower Legionella samples. You can see that over just the simple act of testing for Legionella pneumophila that they conclude is probably the key driving force to the improvement of what's been happening in Quebec. So driving down those concentrations in the cooling towers. One question that always comes up is on the action levels, and that's a very difficult question to answer. As I said, we've harmonized with what the federal government standard has proposed, or not proposed, but is. And the next slide shows you from the National Academies what they've provided as a recommended action level as 50 CFU per mil. Ours is 10 CFU per mil, which is also the federal government standard. So there's an excellent reference there if you need it. The next slide, because of these proposals, we're going to be obviously expecting more people interacting with cooling towers, actually looking at them. So this is a picture of a couple of City of Vancouver workers at a ground level cooling tower at the Blodell Conservatory wearing their half face respirators. The next slide shows you with us visiting with some of the New York City health inspectors. Again, PPE is obviously something to be considering here. And the next slide shows you from BC the risk advisory that was put out a few years ago for Legionnaires Disease. And then one from New Zealand, which is quite excellent, which focuses on cooling towers. And the last few slides, the next one we're going to show you, maybe some of you have heard about special events and Legionella. There was this event center had a very large outbreak last year. The next slide shows you how many hospitalizations and deaths resulted from people simply appearing to have walked by a contaminated hot tub. And so for this reason, we're working with Vancouver Coastal Health on preparing guidelines for special events. And if you, in the meantime, we would suggest what North Carolina has prepared, a one-pager, which is on the next slide, which is an excellent reference, which they developed in collaboration with the CDC. So this is something that you can use right away for your special events. So in summary, basically, in terms of public health policy, as I said, make friends with your building department. You don't want to be, so if we can skip to the next slide, if you don't want to be like Bremen in 2016, 2017, where they're having fatalities, this outbreak's going on for 5 months. They don't know where the infection source is because they don't have any kind of cooling tower registry. You have that cooling tower registry in place, you're going to skip all of that heartache, right, and potentially save lives. This is a recommendation from the National Academies as well. You know, have a cooling tower registry. It enables that rapid public health response. Also helps you to assess the contribution of cooling towers to the overall disease incidence, kind of like those studies we were showing out of the UK. And then consider also monitoring for those with Legionella. We've just finished a multi-city project that was supported by the Urban Sustainability Directors Network and NSF International with like a template for what a registry could look like. It's free. There's the website link for you as well. And again, we're happy to answer any questions about that. So the last slide is just our acknowledgements, and much like Mark's work, there were many, many people. Oh, sorry, this is another reason why to make friends with your building department. This is not a cooling tower, but hopefully by the end of this presentation, you see why this is a terrible idea. This is a senior center, and somebody has decided that it was better to just rig a little, I don't know, hosing with spraying water once in a while into the air intake of the senior center. Needless to say, the health authority had this removed promptly. But your health inspectors may not see this stuff, but your mechanical inspectors will see this sort of thing. So the last slide is the acknowledgements, and then our contact information. So I'll turn it back to Tina to do the questions part.
Thanks so much, Chris and Phil. So we'll begin with question and answers. Let's start with first one. I believe first one is for Mark. How many additional CTs were identified beyond those identified through satellite imaging by the EHO visits to the buildings in the area?
So is this question pertaining to like, maybe it's what I've shown in the outcome of the assessment there, where we found about 20, just under 20 cooling towers in that 4-kilometer radius. Does that answer the question? I missed the first part of it.
I think so. Jinhee, if you could just clarify if Mark answered your question. Just moving on for time's sake, was it difficult to conduct the enhanced questionnaire with the ill patients? Is the enhanced questionnaire publicly available?
And yeah, that is a very good question, and definitely it's true that at times it is hard to contact. We do have to interview proxies at times. The enhanced questionnaire was something we developed during the outbreak here at Fraser. If jurisdictions were interested to see what it was we put together, we're happy to share it. Please do get in touch, but it's not public. We haven't posted it or anything like that.
Okay, thanks. And is the range road tool available online?
That one's not available online at the moment. You have to reach out to a specific team at Environment Canada. So again, actually my acknowledgement slides had the names, but if you would like me to, I'm happy to put you in touch with them as well.
Great, thank you. And what was the concentration of Legionella pneumophila in the matched water cooling towers?
That I don't have that on me. I'm sorry. But if you're curious, please do get in touch, and I can find you that information.
Great, thank you. How often are we seeing Legionnaires disease being sourced to non-waterborne origins, such as soil?
In the Fraser region, it's definitely minimal, much more rare than Legionnaires disease from water sources. And actually, to be fair, I guess it's not necessarily Legionnaires disease, Legionellosis cases. We have had a handful in the last 10, 15 years, but it's vastly smaller than the amount from water sources. And that's only, I guess I'm referring to Legionella longbeachiae, which is the species that's usually found associated with soil exposure.
Thank you. Okay, another question. Does Ontario have a cooling tower registry? I'm not sure if anyone online who's from Ontario might be able to answer, or if Mark, you would know.
This is Chris at Vancouver. City of Hamilton, Ontario is the only one we know that has a mandatory registry, and I believe London Middlesex Health Unit has a voluntary one.
Great, thanks. Next question. What are the prescribed testing methods?
So this is, I'm assuming, referring to the testing for the monthly testing for Legionella. So that would be what we're expecting is a culture-based test. So no PCR, it'll be a culture-based test.
So there was a clarification from Jinhee. She said, yes, you showed all the cooling towers versus all the buildings EHOs had visited, wondering how many were identified that weren't seen on satellite imagery.
Oh, I see. Yeah, so we don't actually know. So it wasn't only satellite imagery. There are other means that they use to try to hypothesize which buildings might have towers. And in absence of something that requires people like Chris and his team have set up to report cooling towers, I guess we wouldn't know any that we've missed, unfortunately. I think, yeah, that answers that question. But.
Last question, what resources did you use for PPEs, and did you consult Occupational Health and Safety Department?
So probably the best reference you can find is the US CDC's got a sampling procedure and potential sampling sites document. Bottom of page 2 tells you exactly the PPE. So that would be one source, and the others were the WorkSafe documents that I referred to.
Great, thank you. So that was the last of the questions, unless we have any questions. Okay, no. So that was the last of the questions, and the slides and the recording will be posted on the NCCEH website next week. Sorry. And if you have further questions, feel free to email Mark, Phil, and Chris directly. Oh, one last question came in. To which agency do the cooling tower owners send their Legionella test results to?
So the agency would be the City of Vancouver Building Department, Plumbing Building Department.
And then all those data are going to be shared through open data and on van maps as well. So the health authorities have instant access to those data as well.
Great, thank you. If I have a question. Okay, no, go ahead.
Okay,
last question.
Yeah. It's a question in room, sorry, to squeeze this in last minute. It's fantastic. Thank you very much for this webinar. You mentioned that you had great participation from building owners and facilities managers and whatnot. Just wondering, that is obviously a key to the success of this project, and an ongoing positive relationship is important too with the annual reporting. So what do you think is the key ingredient to make that get off on the right foot?
Yeah, great question. It's a lot of sweat and a lot of legwork. We deliberately tried to keep things as simple and evidence-based. So simple, evidence-based, and then when we presented the material, whether it was BOMA, whether it was the Condominium Homeowners Association, whether it was other groups, we found that there was just excellent reception to the need for this. Sorry, we got other people coming into the room, so we got to get going.
Okay.
Okay, great.
Thank you very much.
Thank you. Have a good day, everybody.
Thank you so much.